Anchorage has some of the most restrictive mandates in place, yet, based on population, Anchorage has the second worst infection numbers. The masks don't work, and the mandates don't work.
If I take my kids out of gymnastics, because I do not agree that it is safe to run around with a mask on, then I'm vilified for taking away money from a local small business. I have family members with medical conditions that keep them from being able to wear a mask. These medical conditions are very serious because their personal doctor has warned them many times not to wear a mask due to the risk of infection that could cause blindness. So my question is, if someone does get a negative side effect from wearing a mask, are you liable? According to Dr. Fauci, the cycle threshold for a PCR test should not exceed 35 cycles because beyond that, the test is showing positive for dead nucleotides. The state of Alaska uses the cycle threshold 37 with 40 on the backup test. That is a factor of 1,000 times more sensitive than the cutoff recommendation by Dr. Fauci. This contributes to the healthcare shortage because we have healthcare workers sitting in quarantine who should be working, not to mention cases that aren't.
When the PCR test was designed, it was to let you know something was there. They can test for anything. It just signifies that it's there, not that you're sick. I went through all 9 studies on the Department of Health's website, your own website, okay? All 9 of them. Not a single one was definitive that masks work, because they don't. You cannot hide from a virus. It's out there. It's a May. This one used a model. You had a futuristic one on there too from 2021. That was interesting. But the PCR test will also show positive for a coronavirus. There is a human coronavirus. That's going to show up on a positive test. That's the common cold, by the way. As you, Ms. LaFrance, so rudely put, my medical credentials, just because I'm not a medical doctor, does not mean that I don't have an education in Mr. Constant, virology, immunology, histology, biology, biochemistry. These are all standard classes that I take. And I graduate with over 300 credit hours more than the average MD in this town. So don't question me on my education. It's all included, including virology. I served my country to defend your right to do dumb things.